Incoming APHA President, Dr. José Ramón Fernández-Peña, is here now. First of all, let me say congratulations on being the incoming president. Can you tell us about your plans for the year ahead and how COVID-19 is playing into that and your campaign?
Thank you for that question. In the year ahead, I want to focus on the importance of the lack of diversity in the health workforce overall, and certainly in particular in the public health workforce. I think that it's a very important aspect that we need to be mindful about as we try to achieve a better equity in terms of health outcomes, especially with underserved communities. COVID certainly figures prominently in this conversation, as we have seen sadly how the lack of parity between public health workers, for example, contact tracers, and the community needing to have that information has been a challenge in achieving what we needed to do in terms of communicating effectively with the populations that have been hardest hit by COVID-19.
I know racial health equity is an important issue for you. Can you tell us why that is and the work you plan to do in that space?
In the year 2001, I launched a program called the Welcome Back Initiative, where we work with immigrants that were health professionals in their countries of origin, come to the US for whatever reason, and end up working at McDonald's or driving taxis. So our programs work with them to help them re-enter the health workforce in some capacity. Ideally, the one they had in their countries of training or their countries of origin, but at least not working at a restaurant or making beds or taking care of babies or old people, and instead bringing their skills, knowledge, and languages into the health workforce and infuse it with such needed diversity.
You're also focusing on the lack of diversity in the U.S. health workforce and its impact on health outcomes. Tell us a little more.
If you look at the kind of communication or the strength of the communication, the trust that can be established between a health services provider and a community that is being served by said person, parity in terms of cultural language and other kind of qualifiers is a strong predictor of, for example, continuity of care, adherence to medication regimens, adherence to treatment plans, adherence to health education, expected health education. When you're able to explain to somebody in a way they understand or they can trust why it is important to bring the kid back for the second or third round of immunizations, or when you're able to explain to somebody why they're letting you know how many people they have been in contact with so that we can do adequate contact tracing, and that you're not putting people in jeopardy for X or Y concerns that the population may have, you're more likely to be successful. When you see yourself reflected on the person or the people who are treating you, you are oftentimes put more at ease in terms of achieving that connection. If a transgender person can meet with a provider that may understand their journey better than a cisgender person, this patient is going to be hopefully more comfortable sharing their concerns about their health and what they need to do to stay on the path that they want to be.